Hello, everyone. We hope that you're enjoying the 2021 SOMC Nursing Research Symposium. I'm Elvis Walters, the Director of Nursing for Inpatient Services at SOMC. In addition to this role, I also have the pleasure of serving as the co-chair for service, which is one of our 5 strategic values at SOMC. While it certainly doesn't seem like it, I will soon celebrate my 19th anniversary of being at SOMC.
And hello, I'm Amy Fraulini, Director of Critical Care and Heart and Vascular Services, and I'm serving as the co-leader for the service initiative at SOMC. I've been here for 31 years this coming year. We're going to talk to you a little bit today about how we have worked to improve the patient experience using the tears-free process that we have deployed this past year. And we're going to talk to you more specifically about a case study of the Psychiatric Associate's Office.
So as Amy and I came together as the new co-chairs aside Claudia Burchett, our Chief Nursing Officer and the Executive Champion for Service, we began to strategize on rebooting our patient experience initiative. Historically, we were measuring the percentage in which patients rated us with top box rankings at SOMC. So what that means is we were rating how often the patient rated us with the highest score possible when taking the survey. We were only measuring our scores internally, and we weren't benchmarking ourselves against others for comparison. However, in order to truly become the best, we knew we needed to change this approach. Like many of our performance indicators, the decision was made to transition to a percentile ranking to truly assess how we do compare to others across the nation.
So as you all know, especially if you work at SOMC, our organization vision is to be the best. Well, again, like Elvis said, how do you really know if you're the best if you don't compare our results to hospitals and service lines across the rest of the country? Fortunately, we participate with Press Ganey, who is a healthcare industry leader surveying more than 2,000 healthcare organizations throughout the country. So when we compare ourselves to this database or in this database, our percentile rank shows us really how close we are to being the best performer across the country. As a service leadership team, we chose the question, overall likelihood to recommend, to be the question that we measure on our quest to deliver the best patient experience possible. A patient's likelihood to recommend our services or any services has been widely studied in the literature, and it's identified as a key measurement of a patient's loyalty to their healthcare organization. This is our fiscal year 21 dashboard that we utilized as we rebooted our service initiative in fiscal year 21. We identified 7 key service lines at that time that we would be measuring. Those service lines are here on the dashboard. They're inpatient services, the clinician and group perception of care, or CGCAPS, and that is our medical practices. Our home health perception of care was measured, along with ambulatory surgery, hospice, outpatient services, and our emergency department. And Press Ganey gives us the ability to measure each service line, like I said, against similar service lines across the country. It's really apples to apples. So for example, departments like the cath lab in ambulatory surgery, the cath lab is measured against other cath labs across the country in the Press Ganey database. Each service line gets a monthly percentage and percentile rank, and the results compile each month to give us the fiscal year end results. And in the bottom corner there, where you can see the circle, average percentile rank year to date, you can see that we scored, the average top box score was 80%. That's the number there in parentheses. And that really means that 80% of our customers ranked us the highest score they could on their surveys that they got after their experience at SOMC in all of these service lines. But you can see, even though we have 80% of our customers ranking us the highest possible score, when we did the percentile ranking, we really were at the 46th percentile when we were measuring ourselves against all other service lines across the country in the database.
So as we further rebooted our service strategies, we developed a tiering system, which is very similar to what we have utilized for our employee engagement data at SMC for many years. This tiering process has proven to be successful for our teamwork strategic values, so we thought we could certainly replicate some aspects of it for our service strategic value. As you can see, this slide illustrates the variances between the 3 tiers and the work that accompanies each tier. Ultimately, the goal is to be tier 1 with the highest percentile ranking score possible. I'll touch on each component of the tiering system. We will further expand on some aspects in the coming slides. So again, tier 1 is where you want to be, which is the 90th to 99th percentile. Tier 2 follows that at the 50th to the 89th percentile, and then tier 3 is the lowest performing tier at the 1st to 49th percentile. So if we bounce back up to tier 1 there, you can see several tasks that the leaders for that unit or medical practice are obligated to complete as part of this tiering process. So first, the leaders should conduct focus groups with their team members. So we rolled out all of this data. We said, go meet with your team, really start to dissect it, develop a lot of questions, figure out where your breakdowns are, and then strategize as a team on how you can optimize the patient experience based on that feedback. Then roll all that into an action plan, and we'll have you post it to your departmental dashboard with a task list under the service strategic value that you and your team will then utilize throughout the year. So an action plan should be a very fluid document. It's not a one and done kind of thing. And honestly, we anticipate that what your vision and your action plans are at the beginning of the fiscal year may look differently than what they are at the end of the year, because you're trying new things, you're trying to think outside the box, your team is identifying new opportunities that may evolve. So as I said, it's a very fluid document, and we expect that teams will refer to it frequently and then adjust it accordingly. Lastly, under tier 1, each leader completes rounding with their patients for their department. And as part of this, we want you to capture those rounding results and then also reflect the feedback that you receive back into your action plan. So it's a bi-directional flow. You're constantly asking the patient about their experience within your individual setting, what opportunities may arise, and then you take that back to the team and you readjust your action plan accordingly. In tier 2, you're going to do everything, the leader will do everything that I just mentioned, plus they'll document and submit a monthly summary of that rounding to Claudia, our Vice President of Patient Services. And then Amy and I will work with Claudia as part of the service leadership team to further review that summary. So as leaders get busy in their daily operations and they're sorting through their tasks, often there are things that they may do repeatedly, but they just may not capture that they're doing it repeatedly in the contrast of what they're doing throughout their day. So as the service leadership team reviews that summary, we're helping to identify themes or trends, not only within that department, but they may expand beyond the confines of that practice or that unit to involve other areas. So we're helping to try to strategize and identify those opportunities that have more of an overarching theme organizationally. And it may be something that's just at the unit level, and we would help identify that as well. But, again, not one person makes up the patient experience here. It takes a team. So the more eyes and the more brains that we dedicate to optimizing the patient experience, the more likely we are to do so. In tier 3 there, the final tier, the leader's gonna do everything that I just mentioned in addition to that daily rounding log that I talked about. They're gonna document the daily experience, not only the monthly summary, but every patient that they round on that day. They'll document any feedback or opportunities that they identify during those interactions. They'll also come to a tier 3 meeting every month. It's a Zoom, and we have a schedule of presenters, but everybody that's in tier 3 will have the opportunity to present their action plan, their scores, and any progress that they've accomplished. Likewise, it serves as a pretty robust platform for everybody that's in the tier 3 group to offer feedback to one another, insight to one another, and to consider different approaches. Again, service is not cookie cutter, and sometimes we get tunnel vision and we're working so closely that there may be an obvious strategy that we've not identified because we're too close to the situation. So we've really found that platform works nicely to get the team to collaborate and work outside of their silos, but also consider a different perspective from someone that's outside of that patient care environment. And then as part of the tier 3 presentation, structure, after they complete the presentation, it then gets posted to the Yammer networking group, and then everybody goes on and posts a response or key takeaways or additional ideas. But the beauty of that is it serves as an archive that we can all reference at a later date to go back and say, hey, I remember so-and-so experienced this, or what did they do with this? So you can see all of this feedback and all of these presentations to, again, help you kind of formulate your fluid action plan and as it evolves throughout the year. In patient loyalty, key drivers are what we identify as our priorities. And while a given patient survey may consist of anywhere from 15 to 40 questions, the three key drivers will have the greatest impact on the overall likelihood to recommend. So as Amy had talked about earlier, in our quest to embrace a less is best to focus more approach, these are the indicators that we really need to hone in on to make the most significant impact in the patient experience. We certainly don't want to dismiss the insight that's provided by the other questions on the survey, but when we're action planning and directing energy to concise strategies, much attention should be given to the key drivers. And as you refer to this slide here, you can see the key drivers are different for each of the 8 service lines that we have now. And they are established by Press Ganey, who, as Amy said, is our vendor for patient satisfaction, but they complete a statistical analysis of our data from the year. And the key drivers may change or slightly augment from year to year based on the feedback and the needs of the patients that we serve in each of those service lines, which would then may cause us to shift our priorities and focus slightly for the next fiscal year. But the patient experience is continuously evolving, and again, like I said, we should cater it to each unique setting. As you further look at this slide, you can see that Press Ganey has color-coded each key driver to correlate it with some of the essential behaviors that significantly impact the patient's perception when interacting with them. And Amy's going to talk more about that.
So Press Ganey actually makes this slide for us and actually recommends these 3 essential behaviors. Those behaviors are communication, caring behavior, and teamwork. And they really believe, Press Ganey really believes, that if we hardwire these behaviors into the care that we deliver every day, that those behaviors will really be able to push these key drivers and really push our scores up to be the best. This is really a tool for leaders to utilize to increase their scores in their individual units. You can see, like Elvis said, the caring behaviors are color-coded to the key drivers. So if you just look at the inpatient service line there on the left, the top key driver is nurses treat with courtesy and respect, and that's color-coded in green. And the caring behavior at the bottom really drives that key driver. And so leaders can look at that caring behavior and really kind of mentor their staff or coach their staff on the things that drive that caring behavior. Things such as just a gentle touch on the arm or the shoulder when you're speaking with a patient or a customer, slowing down as you're talking and explaining things and being fully present with that patient. Recognizing the patient's experiencing some suffering, having some empathy for those patients. So this just gives the manager or the leader some ideas where they can coach for improvements on the delivery of these caring behaviors.
So as we've shared with you, for FY21, we totally kind of revamped our strategy around service and the patient experience. And as part of that, we wanted to ensure that we were providing our leaders with data that was meaningful to them. And previous to FY21, we had sent out a report that was about 300 to 400 pages, and it consisted of organizational data from every department that receives a patient survey. And a lot of leaders reported that it was kind of overwhelming to have all of that organizational data, and it really made them unable to focus at the unit level. So when we were restructuring this, we said, let's develop 3 core data elements that we would send each month to the leader to then further share with their team and have additional discussion with. That way they're not having to worry about getting in the Press Ganey Sani platform, extracting their own reports because the reports are kind of tedious to build and extract the data. So we wanted to feed them the data, so that's where they could place their energy, was then reviewing the data and discussing it with their team. So the first report that we send is a monthly snapshot report, and on that report it will list the individual likelihood to recommend for their unit or department, and it will list the data points that correlate with their 3 key drivers that we just reviewed. So it has 4 pieces of information on it. Again, we're trying to focus more on a smaller amount of data so we can drive some real change and move the needle. The next thing that we did was a monthly query report. And as I said earlier, we don't want to be dismissive of all the questions on the survey. And some surveys are like 15 questions, and some may go up to 50, depending on the individual service line in the patient care area. And there are several things that really kind of dictate what questions we list in that survey. We're required by some of our governing bodies to list some of the questions there. And then some of the questions we list custom for SOMC because it may really drive the service in that area, and we want to seek to better understand. So on that monthly query report, it'll actually list every single question and the percentile ranking and the scoring for it. So again, we want the teams to focus on that because they may gain additional insight or say, okay, we're doing really well with our key drivers, but our likelihood to recommend isn't moving, or we're scoring super low in another area. So we want them to review that report each month as well. And then the other piece of information that we share with our leadership teams is this illustration here you see on the slide. It's the patient experience report card. And we use a similar visual aid with our hand hygiene compliance on inpatient units. So you can see at a snap, just a instant in time, what your score is, what your score was last month, and where you're at for the year. So we kind of mimic that for the patient experience, and you can see on this one, it's for the psych associates, and you can see what their score was for FY20, and then where they started for FY21 in July, and then their year-to-date score, because our scores are cumulative, and they compile beginning at the fiscal year and run through the remainder of the fiscal year.
Rounding logs are available also to all leaders, and we expect leaders at SOMC to round on their patients. We expect inpatient leaders to round 100% on all inpatients, and in our outpatient departments, we expect that leaders round on at least 10% of their outpatients in a week. Rounding is really the most important thing that leaders can do to really touch base with what is going on with their customers and to glean information of what they can do to provide better service for their customers. Leaders ask the patient if there's anything they can do to improve their overall patient experience. They also ask if they would recommend our services after they have actually had their visit, or if they've been a patient with us in any capacity. And the leaders also round on their 3 key drivers for their service line. As they're doing this rounding, they document on these rounding logs anything that they learn from the patients regarding their service experience. And then the next thing that we do is we ask the leaders to build a service action plan from the information they obtain from their rounding logs. They look at their rounding logs. They can trend any problems, any processes that did not work, or anything that has happened that really impedes a perfect patient experience in their department. Leaders look at their trends, they work to get to the root of the problem of the process breakdown, and then they develop action plans to find a better way to deliver their service. The service leadership team has also developed some skill reference guides that can be pulled from the SOMC intranet on demand for leaders to utilize in staff huddles or coaching opportunities. There are also videos that are connected to these skill guides that can be used for yet another tool to help coach our essential service behaviors. Leaders are encouraged to use the best practices that are highlighted throughout the literature, and the skill reference guides highlight some of these best practices, such as AIDIT+C, leader rounding on staff, rounding by the frontline staff, hourly rounding by the frontline staff, and also bedside report, just to name a few.
And then, as I mentioned another resource is the collaboration that occurs at the Tier 3 monthly meetings and the Yammer platform. In addition to that, Press Ganey Fusion, which was formerly called Press Ganey Online, has many robust resources for our leaders to utilize, from videos and white papers to community forums in which they can go on there and discuss any service strategies or challenges and consider different approaches. Like Amy said, with us really trying to benchmark across the nation, we try to do an apples to apples approach. And so people can get on there and communicate with people from another apple orchard per se, and try to strategize on maybe some of the similar challenges that they've experienced in that workflow. In addition to Amy, Claudia, and me, we have a larger group that comprises the Service Strategic Value Leadership Team that Amy and I keep mentioning. This team meets monthly and reviews our current plan, considers new ideas, and again, really works to identify trends or themes on our patient experience opportunities. And there are directors represented from each of the 8 service lines, and each of those people serve as a valuable resource to their leadership team in efforts to lead the overall organizational service initiative.
Here are 2 examples of our service skill reference guides that we have on the internet as a resource for our leaders here. And of course, the first one, these are really to help with just basic essential skills to help coach our employees. The first one, how to introduce myself appropriately to a customer. And this highlights AIDIT plus C. And then the second one, how to effectively round on patients to facilitate an improved patient perception of experience. So this just goes through basic steps on how to knock and greet the patient and manage the patient's expectations, etc. So really nice reference guides for managers to use.
And as Amy and I mentioned initially, we were going to discuss about the strategies that we deployed to revamp the service initiative at SOMC, but then to show you how that it's been applied within the Psychiatric Associates Office. So again, if you look at this report card here, you can see where they were for FY20 at the 24th percentile ranking. And as Devin, the manager of that office, really met with his team to strategize an action plan, the fact that they went to the first percentile for the next fiscal year was a bit of a kick in the gut for that team, but it also was an opportunity for him to rally the team and leverage that score and say, guys, is this score really reflective of the care that we provide in our office? And is this who we want to be? Because this is how the patients perceive us. So while they did drop from the 24th to the 1st, it certainly motivated that team to say, guys, we only have one way to go, and that's up, and we're committed to doing that.
So on September 18th, 2020, we call this the day of the intervention. The Service Strategic Value Tier 3 kickoff meeting was held to outline process improvement activity expectations for each department that was in Tier 3. And again, those were the departments that were from the 1st percentile to the 49th percentile as they finished up fiscal year 21. So for the overall likelihood to recommend. So on this intervention day in September, Devin Miller, our office manager for the Psychiatric Associates, leveraged the resources provided by the initiative and the things that we rolled out that day in that meeting to engage his team. And he really worked hard to engage his entire team. And that's so important as we work to move our service scores to perfection. He engaged his advanced practice team, his social work team, and his entire office staff to encourage them and push them to find a better way to deliver service in that office. His goal statement was to increase CGCAP's percentile ranking. For the question, would you recommend this provider's office to your family and friends?
And so I'm going to talk about some of the specific activities that team utilized and deployed to optimize their score. So as we've kind of said, the patient experience is not one person. It takes an entire team, from the people that are behind the scenes to the people that are at the bedside. So because the entire team formulates the patient experience, it makes the most sense to incorporate the entire team into the data review, the action planning, and of course, the implementation process of your strategies to optimize the patient experience. And if the team doesn't buy into the service journey, it's certainly difficult to move that needle, if not impossible altogether. So Devin really did work to rally the team to come together to make a plan. And patient rounding, in the inpatient world, patient rounding has been a practice for a long time. But if you think about it, in our workflows, we get the patient admitted, there's a lot of downtime. So we kind of have them held in a captive audience. But if you think about your visit to a medical practice, your family doctor, or to a specialty provider, it's a scheduled visit, and the flow is a bit more structured than on the inpatient setting. So really, the leadership team for our medical practices had to come together and say, daily patient rounding is a little bit foreign to us, and how can we come together to integrate it into our daily workflows? So Devin collaborated with many of the other leaders to say, how can we accomplish this? Because we do believe the feedback's important, and we certainly want to gain that insight. So as I said, he strategized with his colleagues, and they started completing face-to-face meetings with patients during their office visits if there was a pause in their flow of their visit that would allow such. And they would also call patients over the phone. So just because the patients went home, it doesn't mean you can't call them and say, hey, we appreciate you taking a minute to talk to me. How was your visit the other day? Was there something that we could do better? Because we strive for perfection, but we know we have opportunity. So if you would not care, could you please share some of that insightful feedback with us? Because we really care about you as a patient, and want to improve the way that we do things here. The other piece to this that was a little bit challenging was, we're trying to implement this amidst a global pandemic. And with that, patients, some are scared to come in, some want to come in. Sometimes we had to restrict the availability of office hours. So with that, we had to leverage our technology too for the patient portal and for telehealth visits. And Devin and his team really worked to expand that, especially to the psychiatric population, because they need to maintain their appointments, and whether it be in person or whether it be by telehealth. But they were committed to whatever technology it was, whether it was in person, on the telephone, or via portal, to gain as much insight as they could about their patient experience. But the other thing that Devin shared was patient rounding allowed the team to really drive it home that the patient, and they reiterate that their experience matters when they talked with the patients. They would also work in real time to resolve any issues that presented, and encourage the patients to complete a survey as well. So not only did rounding help identify some important perceptions in their service, they were really able to talk to the staff about how every interaction is so powerful, especially when you do have a low number of surveys. Devin said that, just a lack of follow-up or even a tone of voice could turn a positive experience into a negative one. The other thing that they did too was utilized a lot of scripting. And when I talked about low response rates with their surveys, Devin really challenged the team to begin asking at the close of the visit, as a personal favor to them as the provider, to complete the survey, whether they received a text link, an email, or a paper survey, for them to really take the time to provide some insightful feedback, because they really were committed to making things better in the office. And that is one of the best practices that Amy talked about earlier, is to really ask that as a personal favor, as a gesture to them, versus giving them a piece of paper that says, please complete the survey. And as I said about the patient portal, and the aspects of the virtual platform that it offered, so they were able to increase their portal enrollment, which also offered the patients the opportunity to communicate with the providers. They could send them messages through the portal, and then the providers could also respond to their communication needs as well. So these are just a few of the things that team was able to implement based on the feedback from rounding, and then also as they analyze their data. And ultimately, what was the outcome based on all those actions and interventions? They were able to improve the score that Amy talked about, their goal statement earlier. So they were able to optimize their likelihood of recommending. And Amy's going to discuss that data on the next slide.
So this is the success story of that psychiatric associate's office. And you can see here on the graph in July 2020, the beginning of our fiscal year, they were at the first percentile. And then in September, that was what we called our intervention month. That's when we had our tier 3 meeting with all of our leaders that were in that bottom tier. And we kind of laid out our expectations, and we laid out a bunch of tools that we've talked about here today to offer to the leaders, and really trying to get everybody on board. Devin has just been a superstar from day one when it comes to service. He's really grasped all of the tools in the toolbox that we've shared with him, and he went back to his office and again engaged his entire team, and was especially committed to increase those scores from the first percentile. It really does take every single person, not only the leader, but also all of the staff, and especially all of the providers. And I think he really did a great job of getting everybody on board there. So you can see the nice progression of the scores. And in February of 2021, the office went up to the 59th percentile. And in the world of percentile ranking, that is huge to be able to move that much in an 8-month period. So that took a lot of dedication from Devin and his team, and we'd just like to say congratulations to them. And we wanted to share this today as kind of a case study, just to get it out there to anybody that's on this symposium, to show everybody that it can be done. And it just takes engagement. It takes looking at the best practices out there and the tools that have been shown and proven to work over time to engage our customers and to improve that patient experience.
And so that brings us to the end of our presentation here. And as you have listened to us talk, and if there's something that has, probe some additional questions, don't hesitate to reach out to Amy and I. We'd be happy to talk to you about service. Obviously, we're a little bit passionate about it, as you can tell. So our email addresses are there. Again, don't hesitate to reach out with any clarifying questions, or if you have another topic or another idea regarding the patient experience, we'd love to entertain that. And I just want to say again, as you're listening to this presentation today, obviously you have a linkage to healthcare to some degree, whether you're an employee at SOMC or you're employed with one of our community partners. We want to challenge you as a healthcare clinician to ask yourself each and every day that you go to work, how will I make a difference in the patients that I serve today? Because it's up to each and every one of us. It takes an entire team, and healthcare is complex, as we all know, and it allows lots of opportunity for us to have a Swiss cheese effect. So we each have to take ownership of our patient experiences and commit to not settling for the status quo. If there's a problem identified, we need to work together to fix that issue, because our patients are counting on it.
And I would just like to say, if you all have your own experiences, we all probably have healthcare of some sort or another and are visiting different departments throughout our organization. If you all have experiences and you have breakdowns in service or things that you think could be improved, do not hesitate at all. It's all of our jobs to reach out to the leader of that department where you had your services, or you can reach out to me or Elvis, and we'll be happy to help. But we really are interested in understanding how our processes are working, good or bad. If you have a breakdown in service, we want to know. If you have a wonderful experience, we want to know, because it's great to be able to give feedback to our teams here throughout the organization when we have customers that have great experiences also. It's always great for our team to be able to hear that and to know that they've really made a connection with our customers, and they have helped with that patient experience and making it exceptional.
We appreciate you taking the time to listen to one of our patient experience success stories, and we hope you enjoy the rest of the Nursing Research Symposium.
Thank you.